Discovering a thyroid nodule can be unsettling, and it's natural to feel a wave of uncertainty. But remember, you're not alone. Many people experience this, and there's a wealth of information available to guide you. It's normal to worry when you find a lump in your neck. Your mind races with questions and concerns. Or your doctor mentions a thyroid nodule, especially if you're unfamiliar with what it is. Let's clear up the basics. Your thyroid is a small butterfly-shaped gland at the base of your neck, playing a vital role in your body's overall function, producing hormones that control your metabolism, influencing everything from your energy levels to your heart rate. A thyroid nodule is simply a lump or growth within this gland, a localized change in the thyroid tissue. Sometimes solid, sometimes fluid-filled, and their characteristics can vary greatly. Most importantly, the vast majority of thyroid nodules are harmless and non-cancerous, offering significant reassurance. While any new lump should be checked by a doctor, just to be safe and ensure proper evaluation, most nodules are benign and don't cause problems, allowing you to continue living your life without disruption. Think of them like moles on your skin, common and usually nothing to worry about. They're often just a normal variation. The real fear comes from not knowing, the uncertainty that fuels anxiety. But knowledge can replace that fear, empowering you to make informed decisions about your health. We'll walk through what thyroid nodules are, providing a clear understanding of their nature, how common they are, giving you context and perspective, how they're found, explaining the diagnostic process, and what to expect next, outlining the potential management strategies. My goal is to give you clear, simple information, presented in an accessible and understandable way, so you know what questions to ask and what steps to take, actively participating in your healthcare journey. We'll cover how doctors investigate nodules, detailing the evaluation methods used, what signs are concerning, helping you recognize potential red flags, and what treatment options exist, providing an overview of available interventions. Remember, knowledge brings peace of mind, reducing anxiety and fostering a sense of control. Most people with thyroid nodules live healthy, normal lives without significant impact on their well-being. So, let's dive in and demystify thyroid nodules together, embarking on this educational journey side by side. You're taking the first step toward understanding and control, actively engaging in your health management. Let's get started. You've got this. Thyroid nodules are surprisingly common. Up to half of people will have one by age 60. Most people don't even know they have them, as nodules are often small and symptomless. Many are discovered by accident during imaging for unrelated reasons, like a CT scan or ultrasound. Sometimes, a doctor finds a nodule during a routine neck exam, or you might notice a lump yourself. Larger nodules can rarely cause symptoms like neck fullness or trouble swallowing, but most are silent. These incidental findings are a reminder of why regular checkups matter. If you found a nodule, you're in good company. It's a common part of aging. Most nodules are harmless, but it's important to have them checked. Early discovery means you and your doctor can make informed decisions. If a thyroid nodule is found during a routine checkup or self-examination, your doctor will start with a thorough physical exam. This is the first step in understanding the nature of the lump. They'll carefully feel your neck for any other lumps or abnormalities, paying close attention to the size, shape, and consistency of the nodule. Your doctor will also ask you detailed questions about any symptoms you may be experiencing, such as difficulty swallowing or changes in your voice, as well as your family history of thyroid issues. Next comes a thyroid ultrasound, a painless and non-invasive scan. This imaging technique uses sound waves to create a detailed picture of your thyroid gland, showing the nodule's size and shape with precision. The ultrasound also helps determine whether the nodule is solid, fluid-filled, cystic, or a combination of both. Blood tests are essential to check your thyroid hormone levels, specifically TSH, T3, and T4. These tests help determine if your thyroid gland is functioning properly and producing the right amount of hormones. If the nodule looks suspicious on the ultrasound or is particularly large, your doctor may recommend a fine needle aspiration FNA biopsy to further investigate the cells within the nodule. This quick and relatively painless procedure uses a very thin needle, guided by ultrasound, to collect a small sample of cells from the nodule for detailed analysis in a laboratory. The FNA helps determine if the nodule is benign, non-cancerous, cancerous, malignant, or requires further, more specialized testing to reach a definitive diagnosis. Fortunately, most thyroid nodules turn out to be harmless and don't pose a significant health risk. However, this comprehensive diagnostic process ensures that nothing is overlooked and any potential issues are addressed promptly. Your doctor carefully considers all this information, including the physical exam findings, ultrasound results, and blood test values, to decide on the most appropriate next steps, which could range from simple monitoring to further intervention. The ultimate goal is to arrive at a clear and accurate diagnosis with the least amount of anxiety and stress for you. Remember, the vast majority of thyroid nodules don't require any invasive treatment such as surgery. The diagnostic process is straightforward, well-established, and designed to ensure your safety and well-being throughout. Doctors look for certain features on ultrasound to decide if a nodule needs more attention. Size matters. Nodules over 1 to 1.5 centimeters, or those growing quickly, may need a biopsy. Solid nodules are watched more closely than fluid-filled ones, but most are still benign. Microcalcifications, tiny calcium spots, can be a warning sign, as can irregular or fuzzy borders. Nodules that are taller than wide or invade nearby tissue are also more suspicious. Symptoms like persistent hoarseness, trouble swallowing, or swollen lymph nodes are taken seriously. Most nodules don't cause symptoms, but your doctor will consider everything to ensure nothing is missed. Careful evaluation helps catch rare cancers early, while avoiding unnecessary worry for most people. Why do thyroid nodules develop? Age is a big factor. They're more common as we get older. Women are 2 to 4 times more likely than men to have them, likely due to hormonal influences. Iodine levels matter. Too little in your diet increases risk, but too much can also cause problems. Past radiation exposure to the head or neck, especially in childhood, raises your risk. Family history plays a role. If close relatives had thyroid nodules or cancer, your risk is higher. Pregnancy and hormonal changes can also trigger nodule growth. Most people with risk factors never develop serious problems, but knowing your risks helps guide care. Understanding these factors can help you and your doctor make informed decisions. Most thyroid nodules are benign, meaning they are not cancerous. For the majority of patients, these nodules need only regular monitoring. No immediate treatment is required, offering peace of mind. To ensure there are no significant changes, your doctor may recommend periodic ultrasounds. These ultrasounds are crucial to check for any changes in size, growth patterns, or overall appearance of the nodule. If a nodule grows unexpectedly, begins to cause noticeable symptoms, or presents any suspicious features during imaging, further, more in-depth testing or a repeat biopsy may be needed to determine the best course of action. Surgery is generally considered only if there's a strong and compelling reason, such as an elevated cancer risk identified through testing, or if the nodule is causing bothersome and persistent symptoms. Even in situations where cancer is found within a thyroid nodule, it's important to remember that most thyroid cancers are highly treatable with excellent long-term outcomes. Treatments, which may include surgery to remove the nodule or radioactive iodine therapy, are often very effective, and overall survival rates for individuals with thyroid cancer are remarkably high. The key is not to panic or jump to conclusions. Remember that the vast majority of thyroid nodules are completely harmless, and even if cancer is detected, it is usually a very manageable condition with a positive prognosis. Stay informed about your condition. Don't hesitate to ask your doctor questions and diligently follow your doctor's personalized advice and treatment plan. Seeking support from others who understand can be incredibly helpful. And if you feel comfortable, consider sharing your own experiences to help others facing similar situations. With access to knowledge, a strong support system, and good medical care, you can face this health challenge with confidence and optimism.